Welcome after-school staff members, and thank you for taking time to listen to this presentation in order to better your program and invest in the kids that attend. My name is Megan Givens, and with me are Rebecca Varnador, Mallory McKissick, and Sarah Glenn Burkhalter. We are speech-language pathology graduate students at MUW, and our goal is to
inform you about what it is to have good communication, specifically how language, if it is delayed, can impact communication, and inform you and give you some tips on how to facilitate good language and facilitate good communication in your after-school program.
We are aware that each and every after-school program is unique and that everyone does things a little differently. However, no matter where you are or how many people you're working with, you always have something in common. You are communicating. There is no program that gets to the afternoon without communication. It takes a well-oiled machine to run a program, and it takes even more work to ensure that children are receiving quality care and instruction after the bell rings. As speech-language pathologists, it is our job to work to inform you about communication disorders and ways to prevent them, and also serve as advocates for children who do have communication difficulties and disorders, ensuring that people who are around them the most know how to help.
According to the American Speech, Language, and Hearing Association, a communication disorder is defined as an impairment in the ability to receive, send, process, and comprehend concepts or verbal, nonverbal, and graphic symbol systems. There are many factors that affect communication, including hearing acuity, speech ability, and language proficiency. We will spend time in this presentation talking about a deficit in the area of language impacts communication, specifically how you can identify, prevent, and remediate communication disorders by promoting the use of good language in the after-school setting. After identifying the different components of language, we will discuss how a deficit in the different areas of language can contribute to a child's communication disorder. In order to do that first, we must discuss what language is.
Language is not a physical act, and there is no verb for it, as in to language. Language is a knowledge system, and it constitutes a system of abstract symbols and a grammar for incorporating symbols into sentences. Social conversation, arguing or convincing, storytelling, and reporting are a few discourse subtypes that fall within three major categories, which are conversation, narration, and exposition. Language is made up of 5 components and is a rule-governed behavior. Let's discuss the 5 different components now.
The first component is phonology. Phonology is the collection of sounds or sound systems within a language. Phonology is made up of phones, which are individual sounds. These phones are represented as sound categories by phonemes. Phonemes are the basic linguistic unit and are the smallest units that can change meaning of a word. For instance, t changes an to tan and m to man, which signifies different meanings, though the phones carry no meaning on their own. The next language parameter is morphology. Morphology is the system of meaningful units of language. Morphology is comprised of morphemes, which are the smallest units of language that provide meaning. Whereas phonemes change the meaning of a word, morphemes convey the meaning. Basically, morphology relates to word structure. Morphology related to language deals with root words and appropriate affixes, suffixes, etc.
Syntax is the system of grammatical sentence structure. Syntactic ability involves forming and comprehending sentence structures that are sufficiently correct and complex.
Semantics, the 4th language parameter, is the meaning system of language. This system allows speakers and listeners make mutual sense of messages, but a person's vocabulary plays an important role in semantics. The knowledge that a native speaker has about a language is stored in what we call a lexicon. This is where we retrieve and organize words that we wish to say. The lexicon includes information such as the form and meaning of words and phrases, categories of words and phrases, the appropriate usage of words and phrases, and relationships between those words and phrases. Lastly, we have pragmatics. Pragmatics encompasses the social aspects of language and how we use language to communicate. Someone can be proficient in all other aspects of language but still have a communication problem if they have not mastered the rules for social language or those pragmatic skills. Pragmatics involves three major skill sets. The first is using language for different purposes. Using greetings, expressing wants and needs, demanding, promising, and requesting all encompass ways we use language. The second skill we need to have in order to be proficient in the area of pragmatics is the ability to change language according to the needs of a listener. For example, the ability to know when to talk differently to a baby versus an adult, or providing background information to an unfamiliar listener, or speaking differently in a classroom versus a playground are all instances when we need to know when to change how we are using language. The third skill we need to be proficient in the area of pragmatics is the ability to follow rules during communication. Taking turns, introducing new topics of conversation, staying on a topic for an appropriate amount of time, rephrasing when something was not understood, and also using nonverbal signals appropriately are all examples of times when we need to know how to follow the rules for both conversation and storytelling. An important note that we need to remember, though, is that pragmatic rules can vary across different cultures. So if you have a diverse population in your after-school program, be aware that not everything is the same across different cultures. For instance, in the African American culture, eye contact is not encouraged when a child is being scolded. Now what? Using what we now know about language, we can identify what it looks like when there is a problem. When a child has well-developed language skills and is proficient in each aspect of language, they're good communicators. But when they aren't, communication will be broken. We'll go through each language parameter again, talking about how a problem with that parameter manifests, and then how to remediate that problem in order to facilitate good communication.
Primary symptoms of disordered phonology are characterized by difficulty with phonological processing, phonological awareness, and phoneme awareness. Disorders often include difficulty in the ability to detect and manipulate sounds and syllables in words. Also, trouble with identifying the individual sounds and manipulating those sounds within words can be a marker for a disorder with phonology. The consequences of delayed development of phonological areas of language are poor academic achievements, such as difficulty reading and learning. Some facilitation strategies for delayed phonology could be activities to prevent identifying sounds and phones in words, and you could use minimal pairs to practice the sounds that may be causing the difficulty. Primary symptoms that may indicate a disorder of phonology is a lack of morphological awareness. The written, spoken communication is impacted by not applying the necessary markers to words to express intended meaning. The consequences of delayed morphological knowledge impacts a child's academics relating to vocabulary, reading, and writing. Some continue to use less mature forms. Others tend to make morphemic errors in writing, and some may show poorer command of past tense inflections. Some facilitation strategies for morphological language delays include teaching the meanings of word endings and practice decoding the words. Matching games can be played to match the word ending with the corresponding meaning.
For syntax, when syntax is disordered, the following can occur: verb disagreement, incorrect pronoun inflection, and/or incorrect word order. Morphology and syntactic deficits include late acquisition of word combinations, restricted MLU or mean length of utterance, errors occurring most often on verbs, function words, and/or pronouns, errors of omission occurring more frequently than errors of misuse, difficulty comprehending grammatical morphemes, deficits in morphological awareness, difficulty identifying and correcting grammatical errors, difficulty identifying parts of speech, problems comprehending and using complex syntactic structures, extensive use of simple, non-subordinated utterances in narratives, difficulty decoding or comprehending morphologically complex words that are common in various academic subjects. For facilitation strategies, you can get creative. A few that we put on here are using Lego blocks, which can contain a word on each block, and then you can have the child or client use the blocks to build a sentence. And another one, you can have the child cut out a picture of an ice cream cone and some different colored scoops of ice cream, and do the same thing, but instruct them to build a sentence with the ice cream scoops. Also, for each of these, you can use different colors to represent different parts of speech. And after the client is finished building, the instructor can rearrange the pieces that are incorrect and explain why they are incorrect.
Now let's look at some signs and symptoms that can help you identify whether or not a child in your program has disordered semantics. Difficulty learning and understanding new words is one of the primary symptoms that is noticeable. This deficit can be noticed in a child's grades and academic coursework. A limited vocabulary in comparison to peers of his or her own age is another sign of disordered semantics. If a child has a limited vocabulary, this results in a limited amount of words that is stored in the child's lexicon. Therefore, the child will have trouble with word retrieval and word finding when speaking. Another important symptom that may occur is difficulty understanding discourse and paraphrasing. When there is difficulty understanding discourse, communication breakdown can occur. A communication breakdown can occur if the child is not using correct vocabulary when speaking, or if the child is not understanding what is being said. If this happens, there can be confusion when conversing with others and can cause deficits in social interactions. It is estimated that teachers only teach about 200 new curricular words per year, yet students learn about 3,000 words per year. So I have some activities and strategies that you can use in your program when trying to prevent and help treat deficits of semantics, and that can promote vocabulary learning. The largest influence on students' vocabulary is the amount of reading they do, especially reading that includes a rich variety of text. As after-school program employees, you need to encourage your students to read as often as they can. This can happen by setting more time aside for silent reading time in the afternoon and having group discussions about books that are being read. Another strategy is to incorporate and teach words that are most important to the child at the time. Students with weak lexical skills are likely to view all new words as equally challenging and important. So it is important to target words that are used in the child's academic courses. A third strategy is to teach synonyms, antonyms, and paraphrasing skills, which may result in quick learning.
So, what exactly does it look like when a child is having problems in the area of pragmatics? Because pragmatics is a social language parameter, it will manifest as a social language problem. Children or individuals with pragmatic delays or disorders will say inappropriate or unrelated things during conversation. For example, you may be discussing what kind of puzzle the child wants to put together, and they may say, "I had cereal for breakfast." They may tell stories in a disorganized way, starting at the end of their story or from the middle. They may have little variety in what they say during a conversation, or stay on a topic too long and get repetitive. They may dominate conversations, not realizing when it's another person's turn to speak, or they could also miss when it's their turn to speak because they can't interpret the speaker's cues. They could also avoid social interaction altogether and isolate themselves because they don't know how to socialize. It's important to remember, though, that most children have pragmatic difficulties every now and then, and that's normal. We know that children aren't always the greatest turn takers during conversation. However, if problems with social language use occurs often and seem inappropriate, considering a child's age, a pragmatic disorder could exist.
What can you do as an after-school program employee to help children that may be struggling in the area of pragmatics? Well, there's really a lot. We want to give you a few tips to help with the 3 different components of pragmatics that were discussed earlier in the presentation, which were language use, changing language, and following rules. To help children who are struggling with language use, ask them open-ended questions to give them the opportunity to comment, request, and to question. To give them the opportunity to comment, you can ask questions like, "Tell me about," or "What did you do?" To give them the opportunity to request, you could ask questions like, "What do you want?" or "Tell your friend." And then to give them the opportunity to question, say things like, "Ask me." So those are all open-ended questions that really give them the opportunity to elaborate. When they do so, though, you want to respond to their intended message rather than immediately making corrections. Take advantage of naturally occurring situations such as greetings and making requests, and encouraging and mediating healthy social interaction between children. To help kids who are having trouble appropriately changing language for different contexts, engage in role-play games where you could pretend to be different characters facing different types of situations. You could ask questions like, how would you convince your parent to let you do something? Would you do it politely or brashly? Directly or indirectly? And you could talk about which ways would work best. To help children struggling to follow the rules of conversation and storytelling, emphasize the importance of what you can do when you aren't speaking, like listening and making eye contact and using appropriate facial expressions. You could also emphasize the importance of being a good conversational partner, encouraging kids to reword what they say when they were not understood, maybe by asking, "Did you mean to say this?" Also help them comment on the topic of conversation at hand before they start to introduce a new and unrelated topic. If you see a child start to struggle or fall behind in any or all of these areas, because problems in any of these areas can co-occur, you can use the strategies we discussed in combination to help prevent kids in your after-school program from falling behind even more. You're with these children at such a critical time in their development, so being aware of how you can help them grow successfully will help you make a positive difference in their lives. We just want to thank you so much for listening to this presentation and learning what comprises good language, what happens to communication when a child does not develop good language skills, and how to facilitate and prevent language delays and disorders. To give credit where credit is due, we have listed our references here, and we encourage you to use these references to expand your knowledge about language and communication disorders. Thank you.